Hi everyone and welcome to Imaging Experts Pakistan. Today we have got Jasmine Zwal with us and we are going to discuss about the reporting radiographers and what is their role and how a radiographer can be a reporting radiographer. First of all, thank you so much Jasmine for joining us and welcome to the Imaging Experts of Pakistan.
Thank you. Nice to meet you. Thanks for having me on.
Thank you, Jasmine. Jasmine, would you like to give your introduction to our listener, please?
Okay, my name's Jasmine. I've been a radiographer in the UK for 11 years. I specialised in MRI about 7 years ago, and in 2 or 3 years ago, I started a MRI reporting course that I completed. So that was a postgraduate certificate in reporting. As MRI reporting is quite a new field, I struggled to get into it. So I became a superintendent. I sort of went into management instead in the MRI department. And then recently there's been a role that's come up at my hospital to establish the reporting service there for plain film, for MRI, for CT, for all reporting aspects. So I am the project lead working on the reporting radiographer service now at my hospital.
Cool. So we'll come to the topic now. So in a journal, like who are the reporting radiographers?
So in general, reporting radiographers are radiographers that they usually still work clinically, most of them, but for perhaps 60% of their time, so say 3 days a week, they'll be reporting on imaging, depending on their area of expertise. They'll be providing the image reports as well as still acquiring the images on the other days.
Okay. And what is their role? What is their responsibility?
So they're responsible for producing reports. So instead of the consultant radiologist signing off on reports, reporting radiographers can do that. They're also employed as advanced practitioners.
Okay.
So an advanced practitioner needs to fulfill, there's 4 pillars of clinical practice as an advanced practitioner. So one of those is that your clinical practice is specialised, so your specialism is reporting. But on top of that, you need to have leadership qualities. Because of your expertise, you are expected to take leadership role in your department as well. You also are required to provide education to your department. So again, it's all about sharing your knowledge and being a meaningful part of the department. And so you should also be conducting research. So, creating papers or investigating something interesting that you've seen on some imaging. Part of your role will be to audit your work and to conduct audit on areas in the department. So you may do an image quality audit, you may do a reject analysis, find some areas where you're getting lots of rejects of films and working out why that's happening, and then sort of delivering some teaching to your team.
Okay. And what qualification or certification is required to be a reporting radiographer?
So to be a reporting radiographer, the minimum qualification would be to do 1 year postgraduate study at university to get a postgraduate certificate. So generally radiographers will do that in one area. So it may be that they do it in axial and appendicular skeleton, plain film reporting, or they could do a chest reporting course or an abdomen reporting course. And all of those can be done in 1 year. And part of that process, you will do a research module, you will do modules in becoming an advanced practitioner as alongside learning how to report. You can do 1 year and have a postgraduate certificate. You can do 2 years and get a postgraduate diploma. So you may, if you did 2 years, you may do chest x-ray the first year, abdomen x-ray the second year. And then the final year would be if you want to complete a master's in reporting, and then you would need to write either a research study or quite a long dissertation, doing a literature review or something to complete your study.
So what is the scope of a reporting radiographer? Or in general, if we talk about the reporting radiographers, what could be the future scope?
So at the moment, your scope is limited generally by your radiology mentor. And it can really depend which hospital you work at, what your caseload is. So it's only really appropriate for you to report things that you've had, enough clinical practice or experience or exposure to. So for example, if you did a reporting course in a general district hospital, you may not get a lot of pediatric exposure. So you may just report adult only. But this will depend on what you've had experience reporting. Whereas if you worked in a pediatric hospital, it might be quite commonplace for you to report on pediatric imaging. In some hospitals, the radiologists like you to report A&E films and inpatient films, because then they know that there's still another clinician that will view those images. So just for a little bit of sort of protection, they like the idea that it's not just going to be the radiographer that's going to review that film, just to reduce sort of error, etc. When you produce a report for the GP doesn't get to see the image, they only get to see the report. And sometimes those reports need to be more detailed or more tailored to that patient's specific condition. But that is something that you can report. It really depends on your level of experience. So there's not really any limit on what a radiographer can report. It's just how much experience and exposure they can get to that. So, for example, with MRI, the course that I did was to report knees and lumbar spines. But the university that I went to, the institute, would support, because I have done that course and I have the learning of the general how to structure a report, etc. They would support if I wanted to report a different body part. For example, if I wanted to go into shoulder reporting, as some other radiographers have, I could then complete 400 reports with my radiology mentor. He could sign those off, and then I could then open up my scope of practice to report shoulders as well, for example.
Okay. Do you think that artificial intelligence is going to help, uh, especially reporting radiographers?
I think it will be valuable. I think it may help to a degree. I think I still am on the hesitant side of that. I think everyone is that you want a human being to have reviewed the images alongside artificial intelligence. And I think it will improve over time, because a lot of what artificial intelligence is doing is learning. So at first, it may not be very good, but it will improve over time. For example, I think with breast, they've done a lot of stuff with artificial intelligence, with them reviewing images, and they'd sort of got an algorithm, and there was a company and they were like, oh, this is perfect, this artificial intelligence is picking up all these breast lesions. Then they took it to a different patient group, a different demographic, perhaps in another country, and it doesn't work at all, because you're dealing with a different population. So you've started with just sort of maybe white 30-year-old German people, and then you take it to London and you've got a multicultural society and you're testing on different age groups, and suddenly the algorithm doesn't work. But then if you kept using it in that environment, the AI learns and it will improve. And I think it's a good sort of extra flag. For example, I don't know if you have that, where in the UK we have a red dot system in A&E, where the radiographers just let A&E know that they've seen something or if they haven't seen something. And just, the more opinions you can get on an image, the more people that see an image, the better the better you are at not missing anything. So, I think artificial intelligence sort of plays a part, especially with things that you feel required to be double reported.
Yeah. And then I just want to ask about the packages and the grades. Like, what are the salary packages for a reporting radiographers?
Yeah. So a radiographer, a senior radiographer over here in the UK will be on a band 6. We have a band system over here. So they would be earning sort of £31,000 to £37,000 a year. When you become a reporting radiographer, you would then become an advanced practitioner. So you would be a band 7. So you would be on £38,000 to £44,000 a year. So that's about a £7,000 increase in your salary to become a reporting radiographer. If you're in London, you get a 20% uplift on your salary because it's a high cost area to live in London, to work in London. And there is also now some radiographers becoming consultant radiographers, and they would be a band 8, which again comes with an uplift where you'd be earning something between £45,000 to £51,000 a year. That would be if you were really a clinical expert. So if you'd done several reporting areas, you would need a master's definitely to become a consultant radiographer. And you may be running your own clinic or something. There's a lot of work going on at the moment around radiographers in advanced practice in the UK. They're really expanding their sort of scopes of practice, etc. And it really is about your own learning and education, and where you want to go, what you're interested in, and really pushing that agenda to create new services, basically. So it's an exciting time over here for radiography.
Cool. So at the end, would you like to give any advice or any message to the juniors or to the student radiographers?
I think the best advice really is to always review your images whenever you can. So when you're working, whenever you're taking an image, just try yourself to answer the clinical question that you've been asked. Is there a lesion? Why have they got pain? And even if you don't know the words yet or the terminology for what you're seeing, you will, because you are reviewing so many images and having so much exposure to imaging all the time, you will know when something doesn't look right. So when something doesn't look right, try and find out what it is. Try and learn what the words are that the radiologists use to describe these things. And especially if you see something that you think looks very interesting, even if there isn't a report there yet, then make sure you take note of that patient and look back at the report and see what it says. And if you don't understand the words, look them up. That will just, take you off. I mean, when I did the reporting course, it really taught me to look at my images, and, you really learn a lot from doing that.
So very good advice. I'm very impressed. Thank you so much for your time, and it was a pleasure talking to you. And hopefully we'll see you again at this platform with another topic.
Thank you. Thanks for having me.
Thank you. We are going to end this episode here, and we'll come back with another episode soon.